Welcome to the Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance, including the PACE program. And today I'm really excited to have our guest, David Sirignano. Did I say that right?
You did. Sirignano. Perfect.
Sirignano, yes. And David is a pharmacist with us. And we have some exciting new things going on at Cambridge Health Alliance, don't we, David?
Absolutely.
So thanks for coming on.
Thank you. My pleasure. Happy to be here.
Oh, glad to have you. And so let's tell the world what new things we're doing here at Cambridge Health Alliance.
Perfect. So we are, expanding all the time, trying to expand our services. And we actually have, a lot of people don't know, we have 3 retail pharmacies that you actually don't have to be a current CHA patient. Anyone can come and fill their scripts there.
So it's like comparable to like a Walgreens or a Rite Aid?
Absolutely, and a lot of people don't know that. But
right, and where are we located for those pharmacies?
Cambridge Hospital, on the 2nd floor outpatient pharmacy. We have another location at the East Cambridge Health Center on Gore Street in Cambridge, and then we also have our new Malden facility, state of the art, and we have a pharmacy there as well. Just opened a couple months ago.
So this is really exciting.
Oh yeah, exciting time to be a part of CHA. So
you're right. So you do not have to be, and I'm just going to reiterate this for the people because I get this question asked all the time. You do not have to be a patient of Cambridge Health Alliance to come into those pharmacies. Just like you going into a Walgreens or a Rite Aid, anybody can come in.
Absolutely.
Right.
Yeah.
So there you are. Okay. What else? What else is cooking at CHA?
I just got my specialty pharmacy certification. Back in April, that is a new up-and-coming program. It's kind of the future of pharmacy, I like to say.
So first of all, congratulations.
Oh, thank you so much. Thank you.
And second of all, tell us what it is.
So specialty pharmacy, I like to break it down easily for people. Because a lot of people have never heard of it. It's kind of a new topic.
I never heard of it. And that's why I do the show.
And some pharmacists never even heard of it either. So it's brand new.
Well, that's interesting.
Last couple of years.
Yeah.
So it is broken down to 2 attributes: cost and complexity.
Okay.
So what does that mean?
Cost. The cost we know.
And it just keeps getting more expensive all the time.
Right.
Unfortunately, but we have ways to make sure we get coverage for people, which I'm very, dedicated in doing that. I take up a lot of pride into getting coverage.
How do we do that?
So if you are a member of our specialty program, which we are currently, still building our practice.
So we're accepting new members to that program?
We accept new patients all the time. All you have to do is come to CHA and we'll take care of you.
Okay, that's good to know.
But these complexity of these regimens is what really makes it special. These patients require strict monitoring.
Okay.
These drugs have they're highly toxic. There's a lot of side effects a lot of patients need to be aware of, and a lot of strict monitoring that goes along with them. So
toxic means?
So unfortunately there is a risk that's associated with these medications. So we see a lot of hepatitis and oncology and
like Hep C?
Exactly.
That one?
Yep.
Hep C? Yeah.
So although a lot of them are very effective and they cure some diseases, you also have to know the side effects and what to look for so we can take action promptly.
So some people might have to decide whether the benefits outweigh the risks?
Exactly, and that's where we come in too, and we have a close relationship with all the providers. And we make sure that the medication is appropriate for the patient.
Given their medical history, given their...
Medication regimen, medical history, diagnosis, and what's current on the clinical practice guidelines.
And maybe, actually, maybe their composition or their makeup or how strong they are. Would that factor into it?
Absolutely, they're on performance status, so depending on how frail or healthy an individual would be, that would play a role into what we choose. Maybe a more aggressive path or less aggressive, but we always look at the most current clinical practice guidelines. So we want to stay up to date. We want to make sure that again the best treatment at all times.
So does age factor into that as well?
It can.
It can, but it's not necessarily...
The diagnosis plays the big role on how we decide to treat the condition. But see, this is where a lot of people don't realize, what pharmacists do outside of just dispensing medications. When you think of a pharmacist, you think, CVS, Walgreens, Rite Aid, we're behind the counter, we're filling, prescriptions, but then, now we're actually developing a practice with the physicians, part of the healthcare team. So it's a really exciting time to be a pharmacist, and they are now developing collaborative practice agreements with physicians to further, it's all about outcomes for the patient. We want to make better care, provide better care.
Right, and that's the mission of CHA overall.
Absolutely.
Right, for all the things that we do.
We're always striving to be better and make sure we are up to date with the, highest standards of care.
Right, and the fact that we open our doors to all, we care for everybody.
Absolutely, it's a great mission to follow. So.
All right, so this specialty pharmacy, we call it specialty pharmacy. Mm-hmm. It's relatively new.
Yep.
In the last.
I would
decade, in the last 5 years.
So to put into perspective, these specialty medications, they're very expensive. Like I said.
Tell us what some of those might be. Can you name them?
Some patients might know popular drug Humira.
Yeah, we see that advertised.
Yeah, to treat rheumatoid arthritis, psoriasis. So these medications, they are labeled specialty because of their high cost and the rarity of these conditions. Most Americans, they say only about 3% of Americans are actually on a specialty medication, but it contributes to 40% of the overall pharmacy cost. So that's where we come in and we make sure, they're taking it properly, their dosages are correct, you stay adherent to the therapy so that it prevents any resistance or problems with your therapy. So we want to make sure the patient gets the most of it, the medication. So
probably in the case of arthritis or psoriasis, I would think it might have to be an extreme case for someone, right? I mean, lots of people have arthritis and rheumatoid arthritis and psoriasis.
Yeah, I'm glad you brought that topic up because a lot of the times we see that conventional therapies, so drugs that have been along for a long time that are fairly cheap, don't get utilized enough. So we see, if a new patient has rheumatoid arthritis, the guideline says, maybe they should start with methotrexate, which is a popular drug that's been around for years. And it costs, pennies to the dollar.
And still effective?
And it's very effective, and a lot of physicians, unfortunately, don't utilize that step therapy, and that's where we review the guidelines, and we collaborate with the providers to make sure that the right steps are being taken. So not only does the patient benefit with cost savings and the most up-to-date clinical practice guidelines, but the overall industry saves money. So there's actually
that'll keep the expense down for the rest of us, somewhere down the line.
Absolutely. So
right. I know people, they want the brand name drug, they want the
newest, hottest topic.
Right, the one that's out there now, the hottest new drug, like the hottest new car, like the hottest new everything.
Exactly.
Right? But we pay the price for that.
And you know what?
In more ways than one, I would think, with risk factors as well as
side effects.
And money.
Absolutely. So, for example, there was a new study published that they looked at rheumatoid arthritis and they got a group of 700 patients from the VA. And they were talking about how many of those 700 patients who had, a biologic therapy, which Humira is a biologic, that means it's a medication derived from genetic material, which makes it specialty because it's very expensive to formulate these drugs.
Is it an injection or is
yes, an injection.
It is an
yep.
injection. Are all those drugs you mentioned injections?
A lot of specialties are injections, but they don't have to be injections. We have oral oncology drugs as well. Yes.
Okay.
So they actually found out that only out of those 700 patients, only 2.5% actually started on the conventional step therapy. And if they say that if 75% of them actually did, it would have saved the industry $10 million in that year. So just, and you would also think about, well, does that affect quality of life? Does it affect the effectiveness? Are these drugs more effective? And a lot of the times they are.
The original drugs?
The biologic, these new drugs, they're very effective.
Yeah.
But you also have to consider how much more are they effective, and should we start at this conventional therapy first before going to our last line resort. And
that makes sense to me, but I usually, go with, cautiously and conservatively, but if something at the lower level would work.
Well, and remember, these new drugs haven't been on the market very long.
Right.
So we're still learning all the time about what the side effects they didn't know about in the studies, because they have a small pool of patients, because these diseases are very rare. So the drug may have gotten approved on an FDA accelerated approval in only a population of 300 patients or so. Think about that, 300 patients. So that's where specialty pharmacy comes in the post-market surveillance.
Tell us what that is.
So post-market surveillance is when we gather information on these new drugs and report them back to the manufacturer and the FDA to, safely, so they can prompt the community when something happens out of the ordinary.
So in order to do that, you have a relationship with the people taking the meds?
A very close relationship. We want to be right with the providers and their patient care. So
How often would you speak to someone? I would think that you might speak to them if there was any type of a med change or a dosage change, because
Absolutely.
Now there's a change, so you want to make sure that you're on top of that. But
of course,
tell us what that means to the folks.
So we come in at the initiation of therapy. Mm-hmm. So when they first start it, we provide one-on-one consultations, which may include how to administer it, what side effects to look for, make sure the dose is correct.
They usually have a list like this.
Oh yeah. But that's why we specialize in this field, and we are here for the patient and make sure they know what to expect, their expectations, and then we make sure they're comfortable. And then we'll follow up with them in about a month and make sure they're continuing to be comfortable. There's no side effects. They're continuing on the therapy. We provide refill reminders, make sure they're staying adherent. And any problems, we relay them to the provider, and we have a close relationship with the provider as well.
So in dealing with the patients that are on, say maybe you have, I don't know, I'm going to say a number, 20 patients on Humira.
Yeah.
And so you have this relationship, ongoing relationship mm-hmm. with these people that are taking Humira. And then maybe you have, maybe they all have the same side effect, or maybe a few have a side effect that
may not
is
be
new
reported.
Yeah. Right. So then what happens? Is that what you mean? Then you would take that information and report that back to...
Exactly. We will report all side effects when asked to. So what that means is, say a very common side effect is headache. I'll just use that as an example. We will document that, and we capture that data for reporting purposes, to see how prevalent a headache really is, because there's not a lot of information on it. But then when these rare side effects come out, when you see on the TV, may cause liver toxicity, then when those major side effects, happen, which are very rare, but if they do, then we report it with an adverse drug event form, and either through the FDA MedWatch also, which is FDA's website. That's how you can report adverse effects voluntarily to them. And once they start gathering more information, then they actually see how prevalent these rare side effects actually are. Maybe they're not so rare.
Right. So if something like that liver toxicity
yeah.
Was reported over and over again, FDA might step in.
That's when you'll see these FDA safety alerts
right.
come about.
Oh, safety alerts.
Absolutely.
So it wouldn't be that they would stop it.
They could. They could. Depending if the benefit outweighs the risk.
Right. Mm-hmm. Isn't that up to an individual?
If the FDA decides that this is happening too frequently, they may administer what's called a REMS program, which is special monitoring, where now we are talking very strict guidelines for dispensing, and they have to meet a certain standard to get the drug. But it depends. So you could pull it off the market. You could also just make sure physicians and patients are aware of this increased risk.
Right. Wow, there's a lot to it.
Yeah, absolutely.
So, since this is relatively new, you're certified.
Yes.
You got your certification.
Yeah, and it's fairly new certification, only about 250 in the country right now with a specialty certification.
And we have it right here at Cambridge Health Alliance.
Yeah, always, trying to be the most innovative and keep up with, the best care. And we actually have another one of my colleagues certified as well. So there's two of us.
Two of
Yes.
So this is the interesting thing that I'm always saying to the people out here, that for a community hospital, we do an awful lot here. When I was here on my show that I found that we're an accredited stroke center, an accredited breast cancer center, and now we have specialty medicine on board. So, it amazes me always. I guess I have to keep doing the show to find out these things and to be able to tell the people about it as well.
Well, and I'm happy to talk about it and get that word out, and hopefully we start building a practice and you'll hear more from us in the future. So.
Right. So is there anything else that we can tell the people about what you do?
Yeah, pharmacists in general. We also provide medication therapy management services, which is called MTM, which we have an ongoing practice with that as well at CHA. And what that entails is a full medication reconciliation or a comprehensive medication review. And so we have a new patient enrolled in our MTM program, and we go over all their medications. We make sure the patient is well aware of, how to take it, why they're taking it. We take it step by step, and then we identify problems in their medication. Maybe there's an omission in therapy. Say they're diabetic, and we know of the new treatment guideline, and maybe we see that there's a medication they may benefit, based on our reconciliation.
Oh.
So then we'll outreach the provider on the patient's behalf and see if that may work for them. And we look at dosages and drug interactions and make sure it's safe for the patient.
I'm always telling the people out here to only use one pharmacy and not to be skipping around to pharmacies for this very reason, because at least someone is looking out for them. If they're going to many different doctors, and the doctors are talking to each other, and each doctor is prescribing, there has to be, it certainly is better if there is one central record of all the medication.
Absolutely, and that's where you see drug interactions that are missed, duplications of therapy that are missed, because unfortunately the pharmacist may not have been aware that the patient was on that medication. So we always have the patient's best interest in mind, so it just makes the physician's job easier, the pharmacist's job easier, and the best care for the patient at the end of the day. Exactly.
Safer for the patient.
Exactly.
Right. So, so what else? MTM.
We also provide vaccinations. No appointment needed. You can get your shingle shot, annual flu shot we're doing right now. So we can also check the Massachusetts Immunization Registry and make sure that if you're missing an immunization, we can check that as well and see if you need any of your immunizations to make you up to date.
Wow, that's good.
Yeah, and that's something that a lot of people don't know pharmacists do as well. So
Right. So they could come into one of the retail pharmacies for this?
Yep, no appointment necessary. We can check that for them and get it done right then and there for them.
And typically, is that a Medicare? If people have Medicare, is that how that works?
Yep, Medicare B covers the flu shot, and commercial insurance does as well, Mass Health, absolutely.
Right, so that's good for you folks to know, too. Okay, anything else that we do?
So we have what I mentioned, the Collaborative Practice Agreement, which is a new up-and-coming area of pharmacy, which I can talk about. That is, what that means is that we have a protocol in place with a physician, and they let the pharmacist actually provide patient, care functions. So what that means is we can actually write prescriptions. We can order labs that may be, needed for the patient. Mm-hmm. So that is now a new up-and-coming avenue of pharmacy.
So you do that. You have the agreement with the physician.
Yep.
But you do it. You do it on your own when you feel that there is a need. Do you
we actually
notify the physician?
Absolutely, we do but with this protocol, we can do things that the physician is authorizing us to do. So we can have a conversation with the physician, but there's certain functions that we as a pharmacist is allowed to do based on that protocol.
And that all goes into the patient's central record so that
Absolutely.
the physician knows that this has been done.
Absolutely. It all comes back to the physician, so it's just
Right.
better patient care and better access to care. That's why, pharmacists, they say, are the most readily available, provider for these
I see that
patients.
all the time.
You can go to Walgreens, CVS, there's always, CHA, there's always a pharmacist there to help, and we can do a lot more than people think, so.
All right, and you generally have a bit more time.
Absolutely, we
to
always
explain things.
For sure,
Right.
for sure.
So, and I tell people all the time that that pharmacists do so much more than just fill pill bottles.
Absolutely. And we have working pharmacists now in our clinics that work right, directly with the physician, over in Malden and the hospital and our Windsor clinic. So part of the pharmacotherapy team. So it's pretty cool.
Wow. So I think that's where we're going. You mentioned team, and the team approach it seems to work the best, right? If you work collaboratively and you're all working to focus on one patient for whatever reason, then less things fall through the cracks. Is that right?
Absolutely, and the more practitioners and providers that are involved in the care, the better care you're going to get.
Right.
There's always someone there that helps, and something like you said falls through the crack, and then we talk it over with the provider, and then they say, "Oh wow, we didn't see that the first time, and I'm glad you caught that." So.
Right. Everyone has a different perspective and looking at it a little bit differently sometimes, right?
Of course.
Which
yeah.
brings different things to light that the other discipline might not.
Two minds can work better than one. That's the old saying. So.
Exactly. Hopefully. Exactly. Right. So we have a few more minutes. Is there anything else in the wonderful world of pharmacy that we can let our folks know?
There's so much. Let me think. What else? We covered medication therapy management. We covered the new specialty.
Here's a question for you. So to be involved in any of these programs, do you have to be a CHA patient?
No.
You don't have to be.
We are a retail pharmacy. You can see an outside provider. Of course, we always encourage to use CHA, but you do not have to have a provider at CHA.
Okay.
So you can
you can walk in off the street.
Absolutely.
And then
we
what?
treat all patients the same. So.
Then you would connect with that person's primary care.
Yep. We
Is that
coordinate
how it
care. Absolutely.
Okay. Of course, it's easier if they are at CHA and it's all internal, at the touch of a fingertip these days. But you don't have to be.
We can work with it, absolutely.
Okay.
Yep.
And so it's not necessarily a referral from their primary care, as I'm usually stressing that so many things are, because the primary care is you're navigated through the entire system.
Yep.
But so let's go back to these biologic drugs.
Yes.
These heavy duty ones.
Mm-hmm.
These for the rare diseases like the Humira and the what else?
Enbrel
and HIV meds, right?
HIV medications, hepatitis C. Yep.
So for those two, can you if you're not a CHA patient, can you still be monitored that way?
Absolutely.
It works the same way.
Yep.
I just want to be clear and so that people know. Of course, we all invite you to become CHA patients. We always have room for more. And it's it would be a tighter level of care, but it's not a prerequisite.
No.
So that's important for people to know.
Yep, we will still be a part of their benefit investigation, make sure the drug is covered, make sure all the prior
That
authorization.
would be your insurance.
Yep, and make sure the prior authorization goes through. I'm sure a lot of patients have heard that term before, and they're like, what's a prior authorization? We make it easy to make sure that the patient doesn't have to worry about that. We have a full team at our central refill department that's great in handling all those issues. So there's nothing they have to worry about. We can take care of it.
So there's a few more minutes, and there's one point I do want to touch on that just came into my mind about what about if people can't afford a medication? Because I work with elders out here, and sometimes they're deciding between food or medication because the medications are expensive, right? And maybe if they're on a particular program, they only get so much for an allotment, but then what happens to the rest? And they still need the medication.
Or maybe they're in the donut hole that we hear so often.
Yes, that's a topic for another show.
So
that would take 3 shows with the Medicare.
Yeah.
No.
So
That's just to explain briefly, that's the gap that is not covered by insurance.
Right. So we can reach out to foundations on their behalf, and of course we let the patient know every step of the way, and protect their privacy.
But you do that. You're the liaison. The patient
Absolutely.
doesn't have to do it.
Yep, we can help the patient with anything they need. So the foundations are great around town. We also reach out to the manufacturers, and they actually have, copay assistance cards that we can get for the patient too. So we absolutely always try to make sure the patient has access to their therapy.
So that is an important piece that I know that people might say, well, that's a great drug, but...
And that's why it's great to have a pharmacist as an advocate for you. So we make sure, we monitor them. We make sure they always have their medication on hand. And if there's a problem with their insurance, that's where we step in and help them.
So I think, not that you remember this, but I think we're going retro. We're going back a little bit when doctors used to come to the house. And by the way, CHA has doctors that come to the house if needed. And when you have a relationship with your pharmacist, I think then we get a little further away from that, and it was just you go in there, you get your medication, you leave.
Right, yep.
But now we seem to be circling back, and as I have always said, it's all about relationships. Everything is.
For sure, yeah.
Right? Relationship building. And now, so it makes sense to have a relationship with a pharmacist.
I think so, absolutely.
Right, because there are so many things that can be detected, and how do we know as a patient? We might not know that, right?
Right. And a lot of times you don't see what the pharmacist is doing for you because we're behind the scenes.
Right.
We're behind the counter.
Right.
So we are always an advocate for medication safety, and if we see something, a drug interaction, a dose problem, we outreach the provider and take care of it. And sometimes it's behind the scenes, and we'll inform the patient, but that's what a pharmacist's duty is, and we take pride in that.
So they are always out there working on our behalf. Well, thank you so much. I think this has been an eye-opener for me, and I hope for a lot of people watching that there are so many, such a broader scope that pharmacists and specialized pharmacists are doing on behalf of all of us today. So
Absolutely.
thank you.
Yeah,
Thanks
my
for
pleasure.
joining me.
Of course.